Welcome. Today we cover induction agents, the drugs that safely put patients to sleep before surgery. Induction is the moment a patient transitions from being fully awake to completely unconscious. Induction agents are the bridge between the awake state and the unconscious state during anesthesia. There are four key induction agents: Propofol, Ketamine, Etomidate, and Thiopental. Let's examine each one. An ideal induction agent has fast onset, maintains stable circulation, and allows a quick, clean recovery. The reality is no single drug is perfect for every patient. Each has its own strength. We choose the right agent based on the patient's heart, lungs, allergies, and how fast we need to act. Almost all induction agents are given intravenously, directly into bloodstream through an IV line. After injection, the drug travels from the bloodstream to the brain within a few seconds. Now, let's examine each agent one by one, starting with the most commonly used drug today. Agent 1. Propofol is the most commonly used induction agent in the modern anesthesia practice today. Propofol works by enhancing GABA receptors in the brain, calming brain activity until unconsciousness occurs. Propofol has a very fast onset. The patient loses consciousness within the 30 seconds of injection. Standard induction dose of propofol is 1.5 to 2.5 milligram per kilogram. The major advantage: propofol allows smooth, quick recovery. Patients wake up feeling clear and alert. Propofol also reduces nausea and vomiting after surgery, making it ideal for procedures where nausea is a concern. Significant concern: propofol can drop blood pressure, especially in elderly and already hypotensive patients. Another downside: propofol can cause significant pain at the injection site when given through a small vein. Propofol is the best choice for routine, stable patients with no major cardiac or hemodynamic concerns. In Agent 2, Ketamine. It is the only induction agent that maintains the patient's own airway reflexes. Ketamine works by blocking NMDA receptors in the brain, producing what is called dissociative anesthesia. Dissociative anesthesia means the brain disconnects from pain signals while the patient stays breathing independently. Ketamine has onset of 30 to 60 seconds, slightly slower than propofol but still very fast. Standard induction dose of ketamine is 1 to 2 milligram per kilogram given intravenously. Key advantage: ketamine actually maintain or increase blood pressure, making it safe in low BP situations. Another advantage: ketamine preserve airway reflexes and allows the patient to keep breathing on their own. A major concern: ketamine can cause emergency reactions, including hallucinations and confusion during recovery. Important warning: ketamine raises intracranial pressure, so it must be avoided in patients with head injuries. Ketamine is best for trauma, hemorrhagic shock, emergency situations, and pediatric cases requiring quick, safe inductions. Agent 3. Etomidate This drug is known as the safest choice for cardiovascularly unstable patients. Like propofol, etomidate works by enhancing GABA receptors in the brain, producing rapid unconsciousness. Etomidate has a very fast onset. The patient loses consciousness within 15 to 45 seconds. The standard induction dose is 0.2 to 0.3 milligram per kilogram given intravenously. Its biggest advantage: Etomidate has almost no effect on blood pressure or heart rate. This makes it preferred agent for cardiac patients and anyone with the hemodynamic instability. Major concern: even a single dose of etomidate can suppress adrenal gland function temporarily. Another side effect is myoclonus, involuntary muscle jerking that can occur during induction. Important: Etomidate provides no pain relief at all. Always combine it with an opioid. Agent 4. Thiopental. Once the gold standard for induction, it is now rarely used in worldwide. Thiopental is a barbiturate. It works by enhancing GABA receptors, producing deep, rapid unconsciousness. Thiopental has an extremely fast onset. Unconsciousness occurs within 30 seconds of injection. The standard induction dose is 3 to 5 milligram per kilogram, administered intravenously. Thiopental provides rapid, smooth induction and actually reduces intracranial pressures useful in neurosurgery. Its major downside: it drops blood pressure, has slow recovery, and it is unavailable in many countries. Now let's compare all four agents side by side to see exactly how they differ. Onset speed comparison: Propofol, Etomidate, and Thiopental are fastest. Ketamine takes slightly longer. Blood pressure effects: Ketamine and Etomidate are safest. Propofol and Thiopental both drop it. Now let's apply our knowledge. Here are three real clinical scenarios. Which agent would you like choose? Case 1. A healthy 28-year-old patient coming in for elective appendix surgery. What do we choose? Propofol. Fast, smooth, and its anti-emetic effect reduces nausea after surgery. Perfect choice here. Case 2. A 35-year-old trauma patient with a blood pressure of 80 over 50. What now? Ketamine. It rises blood pressure and preserves airway reflexes, making it ideal for trauma. Case 3. A 67-year-old with severe heart disease and an ejection fraction of 25%. Etomidate. Its minimal effect on blood pressure make it safest choice here. Full recap: Propofol for routine, ketamine for trauma, etomidate for cardiac, thiopental for neuro. If this helped, please like and subscribe. Comment below which induction agent surprised you most.